Hi, I'm Kasey Frey, and my guest is Melissa Justice. Melissa is an assistant professor and the clinical coordinator of the medical science program at Arcadia University in Glenside, Pennsylvania. Today, we will be exploring what a physician's assistant is and what their role is in the healthcare delivery system. Welcome, Melissa. Thank you for being here with us today.
Thank you, Kasey.
Okay, so we've all met physician's assistants in our doctor's offices, in hospitals, in emergency rooms. Can you tell us what exactly is a physician's assistant and what is their intended role in these healthcare settings?
Absolutely. So we are considered physician extenders, so an allied health professional with a graduate degree, a 2-year master's program degree, who has studied medicine and is able to practice under the auspices of a physician's license. We have our own license, and we are trained in all aspects of medicine and can be utilized as such. In an effort to, in our training, we are trained essentially to be able to provide medicine in a global fashion. So there's emphasis on primary care, surgical specialties, emergency rooms. So we are essentially employable in almost every aspect of healthcare. I think that's a little different than, say, for example, a nurse practitioner that I know specializes in their program, as whether they do like acute adult care versus family practice. So for us, in every every 10 years, we need to retake our boards, and that has to be, again, in everything. So we have to maintain a very broad spectrum in our education and our clinical exposure. And I think that allows us to be able to be employable in almost any patient setting.
Okay. So Arcadia University is known for its global health initiatives in the healthcare field. Could you tell us a little bit about what differentiates Arcadia from other programs in that sense?
Yes, actually. So for 4 years now, we have worked with a particular nonprofit that allows us to take our first-year students, so out of a 2-year master's program, our first-year students, which are just learning their didactic, their coursework and how to do physical exams, and we take them and do medical and public health missions in Nicaragua. So the first year we did it in Panama, and the last 3 years have been in Nicaragua. So the concept here is that the Ministry of Health does a community assessment and needs assessment as to what community within this country, obviously, that talk about not having access to medicine. And so therefore we then fundraise, we purchase, and through donations and solicitation acquire extensive medical inventory and actually medications, and bring over almost 70 students this year. It has grown every year, and are able to run medical clinics and provide sustainable long-term care for these patients with chronic conditions that have virtually no access. The last 2 years also, because the community needs it was illustrated that, or emphasized that they have issues with not having clean water. We've also done public health brigades as well. So we're able to pour concrete floors to stop the cycle of parasitic infestations and help build sanitation units so that we can, again, continue to improve the lifestyle of these people who are very without any type of resources.
That's awesome. Okay, so what is the typical education that a physician's assistant receives, and could you describe to us a little bit what is the typical candidate who is preparing to enter the profession?
Well, in recent years, I'd say the criteria have become more and more competitive. It is a 2-year master's program. Like I said, you need upper echelon of candidates who apply and have basic medical sciences. Their chemistry, biologies. I think every school has its own list of specific criteria, but again, excellent academic students are the ones who are applying just to be able to sustain the rigorous curriculum that we have here in our graduate programs.
So in terms of scope, what is a PA allowed to do by law, and what are the parameters of their scope, and who determines that scope?
So the scope is very specific for the environment, whether it's a hospital-based position or an outpatient-based position. This scope has been determined by credentialing committees, whether again hospital or private practice, and it is essentially an agreement between the attending physician and the physician assistant as to what they want them to do and in what capacity they can function. It can be anything from as simple as doing history and physicals to, having your own patient load in an outpatient setting versus, or working in surgery, first assist, doing procedures. We do a lot of our own billing and coding, and obviously being able to provide excellent patient care of all else, but also, be able to alleviate some of the financial burden of having to hire more and more physicians to be able to do the same job.
So each doctor determines the scope of each physician's assistant that...
So, because you are essentially operating under we have our own medical license, but you are functioning under the auspices of a physician's license. So it is an agreement that you have with the physician as to what is your scope, but also it's not just that. Then it's the institution that either employs a physician, or whether it's in a hospital setting, their entire credentialing board has to agree on what our scope is, and then that can even be determined by the state so it keeps going up and up and up to the national level. So I think it really determines, but there's different levels of supervision depending on, you could be working in a private community clinic and have a physician that comes around once a week and signs charts. That could be the approved level of supervision, versus working in an emergency room where you work next to your physician, but over time you have, achieved a level of confidence and competence that they don't need to see every one of your patients because you've already established a level of care that is appropriate and what is standard of care. So I think it varies.
Okay. So in your opinion, why are we seeing more and more physician's assistants in our doctor's offices and in our hospitals?
So I think with the Affordable Care Act that has gone into effect, it mandates that all citizens of the United States need to have some kind of medical coverage and some kind of access to care. I mean, that is essentially what the point of it is. However, there aren't enough physicians in practice or even residency programs. So I think in order to ensure that everyone has access to sound and reasonable medical care, that is a huge part of what we do as far as being able to we are physician extenders, extend their care to patients.
Okay, so obviously you must feel the future for physician's assistants is very bright in terms of their role in the healthcare settings. Why do you feel that the role of a physician's assistant will become even more important in years ahead?
I think for the same, the cost of medicine, and at no point do we replace a physician, but we can just, there's a symbiotic relationship that I feel like we can make physicians more efficient and the delivery of care even more efficient. So I think it behooves health systems to employ us because of our level of training and expertise over time, and because we know how to function within the boundaries, within the scope of our practice as to what's appropriate care, that we need to be able to ensure that more patients have more access.
Okay. Thank you for being here with us today.
Thank
We've
you.
learned a lot.
Thank you.